Good afternoon, everyone. We're going to go ahead and get started. I'm going to begin with a gentle reminder to use your conference app to provide feedback on this session and the conference. My name is Rachel Wick. I'm a senior program officer at Blue Shield of California Foundation, and I'm super excited to be moderating this panel of amazing women who are brilliant and passionate leaders in shaping health outcomes through guaranteed income, which is the title of the session, and that is what they are doing. And I want to just go ahead and invite each of them to introduce themselves and share a little bit about their organizations and their work.
Great. Hi, everyone. It's great to be here with you this afternoon. My name is Catherine Kagat. I'm the Research and Program Manager for Mayors and Counties for Guaranteed Income. And first off, I just want to thank ITUP for organizing this conference and really giving us all a space to have meaningful conversations with each other and learning opportunities. And also for inviting mayors and counties for a guaranteed income to be part of this panel. I also am really honored to be part of a panel that has really brilliant women, and especially Dr. Malawa and Lindsay, who are doing really great work in the guaranteed income space in California. So the topic of this conference, the focus of this conference is advancing equity, and mayors and counties for a guaranteed income very much aligns with that focus in terms of advancing equity. And our work is focused on building coalitions of elected leaders on the city level and on the county level who are advocating for a guaranteed income policy. The North Star, of course, is a federal guaranteed income policy. So it's heartbreaking what's been going on now because that North Star seems farther and farther away, where it used to be kind of close. And also we support jurisdictions who are implementing guaranteed income pilots. Not all the members of our coalition do guaranteed income pilots because of budget constraints and that sort of thing, resource constraints. But when they do a guaranteed income pilot, we are there to support them to provide families with an income floor, and seeing that as one of the many mechanisms to advance racial and economic equity.
Hi, everybody. Thank you so much for coming to the session. Whenever there's breakout sessions, I'm always nervous that I'm going to be on a panel talking to nobody, so thank you for coming. My name is Zaya Malawa. I am a mom and a pediatrician and a public health professional, and I'm the founder of the Abundant Birth Project, where Lindsay works too. So we'll tell you both we'll both spend a little time telling you about the project. I can tell you a little bit about the beginning of it. So we started in 2021. I can realize now in retrospect, this is really a product of my heartbreak as a pediatrician, spending so much time in clinical spaces with moms who are experiencing social marginalization to the extent that it's impacting their ability to have a healthy birth. And as a pediatrician, I am there for the sequelae of the birth. And it was really hard on me, driving me to feel very burnt out as I worked in FQHC after FQHC. So part of my mental health therapy was to quit my job, get a public health degree, and do something really radical in the public health space. It's really helped. My PHQ-9 is much improved. And what we did basically is in order to create an environment where everybody can have a shot at a healthy pregnancy, we decided to provide a guaranteed income, which is guaranteed cash and income supplement every single month for folks during their pregnancy and postpartum period, with the hope that we could reduce stress, increase access to resources, and that ultimately would lead to an improvement of birth outcomes, specifically for folks who are highest risk of experiencing birth disparities. We started in San Francisco in 2021 with 150 moms. That was totally philanthropically funded, but we realized that 150 people is just a drop in the bucket. So we came back around. We believe very strongly in a pilot to policy model. And so actually I worked really hard on the California Momnibus bill with a few other advocates up and down the state. Of course, we were able to get Medicaid coverage of doula care, but one of the other things that I was able to slide into that bill is a guaranteed income for pregnant people. And Governor Newsom put that into his budget in 2021, and that actually gave birth to California's guaranteed income pilot. That focuses on pregnant people and foster youth. So currently, California is spending $25 million across 5 sites, I believe, 7, but 4 sites that include pregnant people to support guaranteed income pilots. But obviously, a pilot isn't going to be enough, and so we're very curious as we gather statistically significant data through the statewide pilot that is going to reach just under 900 moms, we believe. Can we prove that this is the mechanism by which we can start to create universal thriving in pregnancy and birth in California and beyond? So that's the Abundant Birth Project, and to hear more about the details, I'll hand it off to my lovely colleague, Lindsay.
Good afternoon, everyone. My name is Lindsay Richard. I am the program manager for the Abundant Birth Project's LA team. Before I dive into a little bit more about me, can we just give a huge round of applause for Dr. Zaya here? I mean, I always have to give her her flowers just because my background has primarily been working with our unhoused neighbors. Within LA County, I really worked with our unhoused neighbors during the height of the COVID pandemic, making sure they had resources, the vaccine services. Oftentimes, they are a forgotten population. And what I was noticing was there were a lot of pregnant women and people that are unhoused, and many don't realize that. I know sometimes, and this is no shame to anyone, but many of us live in our own sort of little bubble, right? So to see that firsthand, boots on the ground in various encampments, and seeing that there were actually pregnant women and people, it just really broke my heart. So through and within that amazing work, I really was able to see the need in LA County, and then from there, it was just meant to be because I stumbled upon this amazing program and was able to see the amazing work Dr. Zaya has said in addition to her team. It really is just groundbreaking. So fast forward to now, program manager for our LA team. One of the main things is carrying on this amazing mission into our sort of pilot expansion period. So as Dr. Zaya had stated, we now have multiple counties. We have LA County, of course, Riverside, Contra Costa, in addition to Alameda, to where we are bringing these necessary cash gifts to our pregnant women and people. In addition to that, I always like to say we talk the talk and walk the walk, to where we also provide them one-to-one individualized support. So we're not just giving them a cash gift and expecting them to just do as they will, but we're also offering optional services to help them throughout their pregnancy and postpartum journey, really touching on one's social determinants of health needs, because the system is not set up for us, as we're going to dive into it in this panel today. So we want to make sure we're supporting them.
Thank you all so much. We did want to get a sense, both because we're in the after lunch hour, but because of our own curiosity, invite people to raise their hands if you are familiar with guaranteed income. Folks familiar? Okay. Has anyone in the room been part of a guaranteed income program or partner?
Woo-woo, one in front.
Yay! Great. Well, it's good to know that everyone has some familiarity. I'll go ahead and kind of tee up a little bit the guaranteed income space, and then we'll just go have kind of a free-flowing Q&A with our amazing panelists and dig a little bit deeper. But our foundation, Blue Shield of California Foundation, and other health foundations have been supporting guaranteed income pilots, research, and advocacy because they are an incredibly promising and frankly proven solution for addressing some of the deep interconnected inequities we see between health, wealth, and income. And guaranteed income programs are not universal basic income. They are designed to be targeted to those communities who have been most marginalized by economic systems, health systems, and other systems, and the generational impacts that has had on their health and other important outcomes. And we know in particular communities of color in our state and across the country have disproportionately been left out. Focusing on communities and communities of color facing the greatest health inequities has put many guaranteed income programs and leaders, made them subject to attacks. That includes lawsuits, harassment, the spread of misinformation about what they do. And we see now those efforts broadening into widespread attacks on diversity, equity, inclusion in many sectors of our society right now. So I'll just say that it's an important moment for health equity advocates and allies, including foundations, governments, nonprofits, all of us in this room, to stand firm in our values and be courageous in the fight for health equity, knowing what we know about health and racial disparities in health. So I'll turn now to the panelists to inspire us, because one thing I know, having been part of a lot of guaranteed income conversations, is that what's happening in these programs is a source of hope, restoring dignity and agency and giving people space to breathe and pursue and fulfill things that are really important to them and their families. So I want to start by asking our panelists to clarify, what are guaranteed income programs and their kind of core defining features? And I'll start with you, Dr. Kagat.
Sure, yeah, so first I kind of want to give like a primer, like a history of guaranteed income, if you will. And it's, so basic income as a concept has been around since like the 18th century. I'm not going to start there because that's basic income and this is guaranteed income. So I'm going to start at kind of like the historical juncture, which starts to shape up as guaranteed income, as something that takes on like economic justice. And so that's in the 60s with the leaders of the National Welfare Rights Organization. These are black women. It's Beulah Sanders, it's Johnny Tillman, and they were leading the work in the National Welfare Rights Organization simply because they were excluded, talk about DEI, they were excluded from the welfare system. Actually, black and brown communities were excluded from the welfare system because they said, if you're a farmer, if you're a domestic worker, that's not work, we're not going to count that for welfare. So this is their response to that, right? And so they called for a guaranteed income. They're kind of, their meeting with Dr. King really shaped his ideas about the way economic justice and racial justice are tied together. And I think many people are familiar with Dr. King's work on racial justice, but I think sometimes people don't look enough about how he really was like, we cannot have racial justice if we don't have economic justice. So that's where I'm going to start at, of the history of guaranteed income, and that's sort of the legacy that we stand on, at least, and the people in this panel, in the way that we work in the guaranteed income space. And I also do want to say, like, black women led us there, right? So they're constantly, I think, asking Americans to challenge themselves, and I think they're the ones that are pushing our consciousness in terms of like what are our rights and what do we deserve. And in terms of like the design, I think Dr. Malawa and Lindsay can speak to that a lot more because they're working on a pilot, but it really is like many cities and counties really look to align it with their policy priorities. And granted, these are pilots at the start, but I think the ultimate goal is a federal guaranteed income policy. So it really is context-based, and I'm going to get to why we need to really pay attention to context and nuances when we speak about guaranteed income rather than simplifying them. But yeah, so that's kind of the legacy, and then I just kind of want to then take us to the present day. Most of the guaranteed income today are built on the work of Dr. Aisha Yandoro, who launched Magnolia Mother's Trust in 2018, and that was the first guaranteed income pilot in the United States. And then Mayor Tubbs, when he was the mayor of Stockton in California, he implemented the first mayor and city-led guaranteed income pilot in the country with the Stockton Economic Empowerment Demonstration, which was launched in 2019. And mayors and counties for guaranteed income is built on the work that he did in SEED. And a core kind of idea within the guaranteed income space is really that guaranteed income is supposed to work with the social safety net. That we need to provide people with as many resources as we can, like a constellation of resources, so that one isn't replacing the other. So there's a lot of like benefits protection work that goes into a lot of these pilots, so that people aren't having to make choices with what resources they can rely on.
Lindsay, could you share a little bit more about the design of Abundant Birth Project and kind of what its core features are? I know most people think about cash when it comes to guaranteed income, but I know you said earlier it's more than that. There's other kinds of support, so would love to hear more.
Yeah, so the amazing thing that I always like to highlight with the Abundant Birth Project is we really lean on no strings attached. Of course there's requirements to meet the criteria to apply to the program, but after that, it's really no strings attached. We want to make sure this cash gift gets to our vulnerable patients and just overall participants during these stressful times when it comes to pregnancy and their postpartum journey. So how our design is that, of course, an individual will apply to our program. We review their application, making sure that it meets our specific criteria, and then from there, once sort of their application is approved, they're entered into a randomized drawing. So making sure that everyone has just equal opportunity with being selected from our randomized drawings. So once a person is selected, that's when the amazing work starts to take place, them starting to receive their cash gift in addition to that one-on-one individualized coaching that I mentioned. So we meet with them, our amazing coaches, meet with our moms on an individualized basis to figure out what are your needs. You know that you're guaranteed this cash gift. Specific to LA County, they receive a cash gift of $807 a month for 18 months, and then our participating, our sister county is 12 months. So when it comes to that time, we're meeting with them to figure out what are your specific needs? How can we help you? Leaning on the large network within LA County to figure out what are the referral systems. One of the things that, unfortunately, due to just all the things that are going on is usually sort of cold handoffs. Well, we want to see how can we have hot handoffs to where we're reaching out to, let's say, a case manager from Black Women for Wellness to figure out, okay, how can we connect this mom to your resources so that, we're decreasing that stress. As we all know, stress plays a huge part in one's pregnancy and postpartum journey. So if we're able to assist in that small parameter of being a referral partner with them, that means a lot to our moms. So after that process of that individualized support, making sure that they have all that they need, in addition to those resources that we hand off, but also Pampers, clothes, various items we're connecting to make sure they have all that they need.
And is it okay if I just add a couple more things?
Of course.
Okay. So one thing I want to mention about guaranteed income is that it's really important that it respects participants' dignity. That's another major tenet of guaranteed income. I think that in this country, we tend to imagine that poor people are monolithic, but the reality is that one low-income person might need cash to fix their car, another person might need some money to pay off their credit card, and another person might need to pay off back rent. And if we only provide cash with stipulations or through SNAP that dictates how you can spend the money, then we're not actually meeting people where they need to be met at, but we're also robbing them of the autonomy and dignity that every single adult should be entitled to. And then I'll also mention, in case you guys like details, a couple other things about the Abundant Birth Project. One thing is the eligibility criteria, which is something that we had to kind of work out with the state of California, because we obviously know, well, maybe you don't know, but in birth in this country, the disparities are very much racially determined. And so recognizing that, but also understanding the political moment that we are in, how can we make sure that this intervention is reaching the population that needs it? So in order to qualify for the program, you have to live in one of our counties. You have to be earning less than whatever your county's family needs level is for a two-parent, two-child household. It doesn't matter how many people are in your specific household. We chose that because we didn't want to have a high paperwork burden where you had to prove, we have exactly 2.5 people living here 40% of the time. We didn't want people to have to do that. And so we worked with community members to determine all of these things, including the eligibility, and the community said, let's just keep it simple and make it high. So that's the income cutoff. And then we index the amount of money that you get in each county based also, again, on the family needs level, because we're really aspiring to build a statewide system, and we recognize the amount of money that you need in San Francisco County is very different than the amount of money you need in Riverside. And so how do we have a systematic approach to determining how much money people get monthly? So.
Thank you for that. You started to talk about this when you mentioned autonomy and dignity, but I wondered if you could go a little bit deeper and talk about how are these programs advancing health outcomes and shaping health outcomes and health equity?
Oh, I forgot to tell you, you guys can go on our website if you want to see our eligibility criteria, but it's basically what are the top 5 risk factors in California for having a premature birth, which happens to be 4 health conditions, one of which is sickle cell disease, and then being Black. Black race is actually one of the top 5 risk factors, so that's kind of what our criteria are. And if you are working with birthing people in any of those counties that we mentioned, you can send them to abundantbirthproject.org and they can apply to the program. Okay, so here's what we're thinking these days. Nobody actually can tell you what the biological mechanisms are that trigger premature birth. Like, we still, as scientists, don't know why that is. But I think part of the reason that we don't know why that is because most of the research has really happened in like a very clinical space. And I am increasingly suspecting that preterm birth, premature birth is more of an issue of your social context. Mm-hmm. And what the research is increasingly pointing to is that maternal stress during pregnancy and preceding pregnancy is really what is leading to these adverse birth outcomes, premature birth and other adverse birth outcomes that are driving these disparities. And so part of what we were thinking about when we launched this pregnancy guaranteed income is how might we urgently reduce maternal stress so that we can improve birth outcomes. And I think, when we were talking to the community members that were on our steering committee, all of which identified as folks who were racially marginalized and had a preterm birth previously, they pointed to lack of financial resources being hands down the most stressful thing in their life. We wanted to build housing, but that takes 20 years in San Francisco. But what takes a lot less time? Giving people a loaded debit card so that they can, again, have the autonomy and dignity to figure out their own housing situation now that we've adequately resourced them. The other thing that I think a lot about in this regard is the social determinants of health. Because I graduated medical school in 2005, and we were talking about social determinants even back then, and yet, I never saw any intervention that actually attempted to modify social determinants. The closest that people get is maybe they're going to get you some resources to help you get to clinical care, right? But that doesn't actually feel like it's addressing social determinants. In addition, here in California 4 years ago, it's hard to remember now, but we had a major Black Lives Matter movement. Can you remember that? 1 out of every 3 people had a sign in their window. But what does it actually look like for Black lives to matter here? Is a question that I often ask myself. And what would it look like for us to actually value Black lives when we have such a preponderance of data showing that even the tiniest Black lives don't stand a chance under this system, And so I think that guaranteed income offers us a really unique opportunity to do some of these things that we purport to care about in the healthcare community, to actually intervene on the social determinant of health. And maybe not even just one, because guaranteed income is providing people the resources they need to intervene on their neighborhood, their nutrition, their transportation. So many education, so many social determinants can be impacted when we provide people flexible resources that they can control themselves. And then the other thing I think is I wouldn't say that Abundant Birth Project is reparations because, there's no apology, there's no acknowledgement, there's no disinvestment from harmful systems. But I do think that Abundant Birth Project is one way that we can say, we see that things are not fair when you are trying to give birth here, and we're trying to do something about that. We're not just looking at the data and shaking our heads. This is an actual thing that we can do to acknowledge this lack of fairness that's deeply impacting people's ability to be alive. So that's what I think. Just that.
Go ahead, Catherine. I just want to add something to that. In terms of advancing equity, I think access is a big part of it too. Somebody said this morning, so many people said this morning that people are insured, but it doesn't mean anything if they're not accessing that healthcare. And I think what guaranteed income does is allow for access. So people are able to pay for copay, and people are able to kind of get maintenance prescriptions and able to pay their contribution to even getting eyeglasses, reading glasses, that's the thing. And I think that this is how we kind of merge social determinants and political determinants. There's this Maslow's hierarchy of needs. When you are able to meet your basic needs, you have the bandwidth to then be an advocate for, as Dr. Malawa said, be an advocate and kind of be a part of your community, do civic engagement. And we're seeing that actually with participants, that like participants are becoming, you know, civil actors, that they are lobbying and they are going to their representatives. So I think, you know, when you are able to kind of care for your health, and that's not kind of this looming worry and anxiety that you have to worry about, then you can think about bigger things and aspire for bigger things. And that's really important. Maybe we wouldn't be here today if we, you know, if people had those resources. And I think that's one of the things where I have to say, warn people that this is why, you know, these oligarchs want to keep people poor, right? Because if they can keep you poor, then you don't get to think about these bigger things. So I think that's a really important thing that we have to kind of keep working at, is like, how do you get people resources so that they can be active civil actors?
Can I mention one more thing? I'm sorry, I keep on doing that.
Yes.
Sorry, guys. But I just have to point out, you know, I am a Black person, and I'm also a provider. And holding both of those identities, I can very much see why Black people don't have faith in Western medicine, because frankly, mine has waned very much through my involvement with the Western medicine community. And one of the things that I didn't expect is that by providing a guaranteed income, we were actually able to rebuild trust within that community in ways that I hadn't foreseen. I mean, one thing just as a very practical term is that we need proof of pregnancy in order for people to be eligible. And so when we started this in San Francisco, people were showing up for prenatal care at like 3 weeks pregnant. If you've never been pregnant before, the OB does not want to see you before 9, 10 weeks. Like, they really don't. And so people were going like, so the very population that was most likely to be late for prenatal care was showing up so early that the San Francisco OBs were actually like, can you tell people that we don't want to see them so early? But I think that the other part of it was that I think people felt newly motivated to re-engage some of these systems, because some of our programs, like our LA program, is actually run through the LA Department of Public Health. And so when you are having like this level of authentic support, not just like services and a handout, but you come and you say, hey, I need something, and we're like, well, here's $800 a month, then I think that allows people to open up and be more trusting of some of the other systems that have that are meant to help them, but historically haven't. I'm going to stop interrupting now.
Keep interrupting. Lindsay, I want to turn to you to talk a little bit about some of the participant stories and what you see in terms of how the programs are shaping women's health and well-being.
Yeah, you know, I have to say this has been such an amazing journey, just to see many of our participants who started and currently where they're at. Many came in just voicing how they felt ashamed, similar to them receiving CalFresh benefits, not wanting their information disclosed because historically there's the shame, welfare baby or welfare baby mama, whatever it may be. These terms, they are passed down from generation to generation. So from the very beginning, really speaking with our moms as they orient into the program, to understand that we're here with you. We're here to fight this fight with you. You're a part of a community. Wanting to make sure that you feel well enough to go through this pregnancy journey and postpartum journey. So for many, you know, throughout their journey, they're starting to see, okay, I don't, as others have stated, I don't have to stress about how I'm going to pay this light bill, how I'm going to pay rent, how I'm going to just make ends meet, you know, this month. So it's just really just been so inspiring. And for some of them, I'll say, hey, you know, you're up to date with your bills, go get your nails done, go get your hair did. That's self-care. That's literally self-care. And that's what's so impactful with this program, is that we do not judge. We trust that our moms will do what's best for them and their loved ones. It's not upon us to shame them or say, oh, well, you're spending it on this when you should be spending it on that. We don't know their situation, so all we can do is provide that non-judgment sort of support to them. I do want to actually share a testimonial from one of our moms. She had shared, the benefits and resources ABP provided help with my confidence that I can make it through this pregnancy. It eliminates most of the stress factors with finding a job, being able to afford the necessities for me and my baby to come. I wish this program will continue. I don't know really what I will do once it ends, but I'm praying it doesn't, because I know it will help me get my life on track with it, since it's already helping me so much already. That is so powerful. it's just amazing to see the overall progress for many of our moms, just to see, okay, I can do this, you know, due to this cash gift and this support in this community.
Thank you for that. Dr. Malawa mentioned at the beginning of her remarks that her organization is focused on pilots to policy. And so I want to turn to invite the panel to talk about, what do you think the potential is for scaling or sustaining guaranteed income programs? And what makes you hopeful about that? And that hopefulness has taken on a new new color, a new shape in the world we're living in now. But I know from the stories we've heard and the stories I've heard how this work is about hope, and I hold the belief that change is possible. So tell us about, what do we need to do to sustain and scale these programs? And I'll start with you, Dr. Kaget.
Sure. Yeah, I just want to say a bunch of figures, because we've been hearing a bunch of heartbreaking figures this morning that have been like scaring me. It's like a wave of just awful data of like who is not being served and all these things, and it's just been heartbreaking. So I want to, in that wave of like heartbreaking data, I want to drop like some hope. So I'm just going to throw some figures out there. So since 2017, there have been 150 pilots in the U.S. 59,000 participants have received cash across 35 states, and we've been able to get waivers in some states, some friendly counties, friendly cities. We've been able to get benefit waivers so that people can have their benefits eligibility protected alongside guaranteed income. Just in California alone, we have had 40 pilots across the state, 12,000 California residents served, more than $180 million invested. These are public and private funds, although what we're seeing is very cool is that there's been a shift to using public funds. So when I first started, people were very defensive in making sure they emphasize no public dollars are going to this. But now I would say like more than 60% of the pilots that are being implemented are primarily using public funds. And then also in 2022, CDSS, as Dr. Malawa mentioned, granted $25 million to 7 guaranteed income pilots across the state, Abundant Birth Project being one of them. And again, because California is a friendly state, we do have benefit waivers for SNAP and TANF. So yeah, those are very hopeful things. And I also want to say, like, we have this very cool thing in the country called federalism. Sometimes it sucks. Sometimes it's a way to protect your state, right? And in this case, it's great because they cannot control what the county and the state and cities do with their money. And we have to always say this, but budgets are moral documents. They're moral contracts. They show what we prioritize, what our obligations are to our constituents. And we have a lot of cities in California that are getting creative with figuring out how to use public dollars for guaranteed income, especially now that people can't use ARPA dollars anymore, because I think you have to spend down ARPA dollars by the end of this year. But so for example, shout out to Sacramento. Sacramento is planning to use cannabis tax in order to fund a guaranteed income for foster youth. This was unanimously approved by the city council, so kudos to you, Sacramento, yay. I'm also gonna shout out my county, Contra Costa. They are doing criminal justice reforms, looking at like maybe we stop criminalizing people and taking money away from resources that we spent criminalizing people, and instead we use sales tax then to do a guaranteed income pilot. And I think it's like 4-point-something million. I can't forget the figure. I mean, it went down from 5 to 4. Whatever, Contra Costa, that's cool. I'm happy with what you're doing. But it's that kind of thing. Like, again, it's a moral document. You're saying, no, we are not going to judge people and automatically see them as criminals. Instead, we're going to invest in people and see the good in people and trust them. So I think these things make me hopeful. The idea that, again, we can protect our bubbles and maybe use that as a way to kind of inspire or provoke people to also fight for their own, for what they deserve as well. I mean, just to let you know, like with the benefits protection, like yeah, California, you expect California to have benefits protection for guaranteed income pilot participants, but we saw that in purple states too. Like Wisconsin has state guidelines to protect guaranteed income pilot participants and their eligibility for their benefits, and also New Mexico. So we're not just seeing like, these coastal cities or coastal states do that. And there are guaranteed income pilots in not so friendly states that are fighting really hard even against like preemptive bills that are trying to ban guaranteed income pilots. So that makes me really hopeful.
Thank you. Dr. Malala?
Okay, I love all the guaranteed income pilots, of course, but I really love the ones that focus on pregnant people in early childhood, and we've been having a lot of movement in that space in particular. I think that one of the reasons why I feel hopeful about that space is that unlike a lot of other guaranteed income pilots that kind of came to guaranteed income from like an economic justice perspective, we came from like a health perspective. And one of the advantages of that, I think, is that the kind of data that we're collecting can make it pretty clear whether or not guaranteed income can be beneficial in this regard. Some of the other pilots that got started were kind of diffuse in what outcomes they were looking at, and as a result, some of their data maybe isn't quite so compelling. Some of the things that are really exciting, so we were the first guaranteed income for pregnant people in the country, but we were not the last. In Flint, Michigan last year, and that's so important because of the historical context of Flint, they were able to start a pregnancy guaranteed income in Flint to initially reach 1,000 moms, but now they're using TANF dollars in partnership with private philanthropy, and they're hoping to reach 10,000 moms across the state of Michigan in 2025, which is incredible to me. And it gives me so much hope that we could circle on back to Flint and try to do right by them. One of the really cool things about Flint is that anybody who lives in Flint is eligible. They don't do any kind of income proof. If you are Medicaid eligible, then your guaranteed income is funded through TANF, and if you're not, then your guaranteed income is funded through private philanthropy. But on the experiential side of that, participants can't feel the difference. And part of why they're doing that is to address an issue that has sometimes come up with us also that we've decided to call internalized stigma, internalized welfare stigma, which is especially for Black moms who have been made the political face of welfare by both parties for the last 40 years. We've internalized it over the last few decades, and it's not simple to receive financial help as a Black mother in this country because there's so much stigma that often can kind of go along with that. And so in order to avoid that stigma, they're saying that if you live in a high needs county, you qualify, not that you are a high needs individual. And so I think that's a really cool and inspirational thing. And then a couple of weeks ago in New York, the governor signed a bill that is basically going to use TANF dollars for every Medicaid eligible pregnant person to be getting a guaranteed income during pregnancy and early childhood. And that just happened. So we're really excited to see how that rolls out. And then the last thing I'll mention is that, I'm really serious about not just the pilot part, but the policy part. Like, I don't want to be fundraising forever, not for but I also don't want this to die when I can't fundraise anymore because I'm burnt out. And so I recognized early on that we were not going to be able to pull off this policy win by ourselves. And so we have been able to partner with groups, 19 other groups, in fact, across the country to form what we call the MIC, the Maternal Infant Cash Coalition, so that we can all be working in lockstep with one another. We share research across all of our pilots, we share policy wins across our pilots, and we share best practices so that if people want to launch new pregnancy guaranteed income, they can learn from what we already know. So those are the things that give me hope that even after Trump got elected, the governor of New York was like, you know what? And then I'm just going to put this out here because of the audience that we're in. This is an intention. I don't think that RFK is going to go for a guaranteed income for this next Medi-Cal waiver. But what about 6, 7 years from now? Wouldn't that be so cool if part of our Medi-Cal waiver included a pregnancy guaranteed income? Because here's the thing, like Whitney Houston, I believe the children are our future. And if we could invest so that children are being consistently born healthy, could you imagine what kind of amazing future that would spell for California? Okay, so when it's time to do that next Medi-Cal waiver, don't leave me hanging, okay? Let's all be like, I have an idea.
And just to add to that, I really want to highlight just the experience that I've just been really exposed to in this program, the power of voice, really equipping our participants on how to navigate these political settings so that they can share their story to folks that may be not familiar with what guaranteed income is and the impact of our mom situations. I think it just sheds light to, it really does take a village. It takes all different sort of specialties, in addition to just understanding for us to all come together and fight for amazing programs such as these.
Dr. Malawa, you talked about just the historical and harmful narratives that Black women have faced in terms of the welfare system. And I wondered if you and other panelists could share what are the stories, and Lindsay, you started this, but what are the stories we need to be telling about the power of guaranteed income and the promise and the impact that it's having as we go out and confront, skepticism and questions and things like that?
Okay, well, one thing that I think doesn't get mentioned enough is the impact of guaranteed income on provider burnout. Like, the pandemic, it took us out, y'all. I don't know if there are other clinicians in the room. There weren't very many people who clapped for that, but let me tell you, it was really, really exhausting. And there wasn't like a period of time where people were like, we know that was tiring, so why don't y'all go on retreat and then you can come back for like less hours. And so provider burnout is like really, really high. For me personally, part of what burns me out is not just the long hours and the paperwork, but it's confronting impossible patient situations and feeling really helpless in the face of it. Like, that's what really, really gets to me. And so one of my colleagues at San Francisco General told me this story about a year ago, which was that she had a mom that she had been taking care of, the mom's kid, for a while, and then the mom came in and she was pregnant with twins. And she was crying in her pediatric visit because she was like, I cannot afford to have these twins. I have a 9-month at home. I don't know what to do. And my colleague Maggie was like, guess what? I know what you can do. And she informed her about the Abundant Birth Project. And the mom got enrolled and was able to have these twins and be housed in a way that she was unhoused at the time when she told Maggie she was nervous about pregnancy. And so when Maggie told me this story, she actually had tears in her eyes thanking me, because for her as a provider, it was just so meaningful to be able to meet a patient with a real need, like with actual support and help. And so I do think that one of the stories we need to be telling about guaranteed income and health is not just the impact on participants, but the impact on providers, especially in this time when I know all of you healthcare manager people are really worried about who's going to staff your clinic. Well, one way to get people to staff your clinic, if you're running a clinic for low-income people, is to have a guaranteed income program for the patients. I also want to just tell this other story. So we actually had a funder briefing because we have a funding gap that continues to grow as the NIH pulls grants. So we had a funder briefing a couple of weeks ago. And we invited, whenever you sign up for Abundant Birth Project, we invite you onto our storytelling pool or our policy pool. And both of those are totally optional, but recognizing that sometimes being able to advocate for your own community is helpful, we want to give people that opportunity. And so we had a few members of our storytelling pool come and tell us their stories about Abundant Birth Project. This one mom told us about how when she became pregnant, they were having such financial straits in their family that they couldn't afford to keep their toddler. They couldn't afford his childcare anymore. And so they actually ended up having to fly the child back to the Caribbean so that the grandma could take care of him while the mom was pregnant and trying to manage things. And that was so heartbreaking because, I mean, for anybody who has a kid, could you imagine? But then she got into the Abundant Birth Project, and she was able to not only have a healthy pregnancy, but as she put it, her older son was able to be the big brother that he was always meant to be because he got to grow up and be a part of the arrival of his little brother. And this is something that all families should have the opportunity to do. And so part of the story I want to tell is, like, for me, the fact that we get to do this 900 times has been so health producing. Like, I can give vaccines and counsel you on what direction to face your car seat all day, and I will have such a smaller impact on your health than giving you a debit card to allow you to have the basic resources that all human beings need in order to be healthy and thrive. And so I guess I just want to help all of you all understand that this is not just about the participants, it's about all of our collective humanity and wellness.
Thank you for that, Dr. Malawa. And it's such a positive way of framing it. Now I'm going to feel like I'm angry because I'm going to say some angry things.
Yeah. Permission to feel the feels.
Okay, great. I just want to say what's been been really frustrating and challenging, given all the situations that Dr. Malawa just spoke about, that we are still having this conversation about work. And not just about guaranteed income, but we're having a conversation about work for welfare, like for TANF, for
Medicaid.
for everything, for Medicaid. And you know, like one of the participants in Tacoma, Stephanie, she had a full-time job and I think 2 other jobs, and she said, oh, I was able to quit my part-time jobs and help my child who just had a child so I could be there with the child and spend some time. And I'm like, how nice. You're working less so you can spend time with your family. And I think we need to kind of question our preoccupation with work as a country, and also like have some kind of moral economy approach to things of like what we're asking people to do, because I think there's been a lot of talk about, well, the guaranteed income shows that actually people are working less, and like, excuse my language, I don't give a fuck. Like if you are working less, because if you're working 2 hours, you have a full-time job and you're working 2 hours less, but that's allowing you to spend time with your child, then I would forsake the 2 hours. And I think it says a lot about our society if we are asking people to spend less time with their family and work in particular jobs. And granted, like the question about the hours being reduced, it's never about the quality of work. It's always just about, are you employed? Are you working more? Those are the questions. There is no question about like, does it have benefits? Do you have paid time off? Does it allow you flexibility? All these things that like probably for most of us in this room get with our jobs, right? We're not like, and excuse my language again, but there's no other word to say this, but shitty jobs. Nobody's asking, are these shitty jobs? And I don't want to live in a society where we are asking people to do more hours in a shitty job rather than work on their relationships. Because you mentioned, it's like you're going to be apart from your child, right? And all these things. So I think like, if you want to go out there and like keep challenging people, challenge them about this preoccupation with work, and ask like, we should all be self-reflective about this, like how are we approaching data, and how are we interpreting data, and what is that telling us about ourselves and what our priorities are? Because I could say that about so many of the data that's coming out with guaranteed income pilots, when people say, well, the health outcomes aren't that great because people aren't like actually physically healthier. I'm like, rich people aren't physically healthier, we just don't study rich people. But like, rich people are not healthier.
They're not working more.
They're not working more. We have a president who is absolutely not healthy. He served McDonald's to athletes, and he doesn't work, and he works from home. Even okay, I'm ranting. But in any case, this is the thing. Sorry for being angry, because she was so hopeful and positive, and now I feel angry.
Let's have them both, though. We need them both.
We need them both. But I do kind of like, myself, like all of us have to kind of be self-reflective in the way that we talk about the nuances of the outcomes of these guaranteed income pilots, and the way that we're approaching data, and what does it say about the kind of society that we want to live in. So we just kind of have more of those moral economy questions.
And I just want to add to that really quick. I know we're running close to time, but you know, for our specific program, that self-advocacy piece, when they're going into these doctor's appointments, getting bad service from or bedside manner from a lot of these physicians, how can we hold them accountable? Some of you may have heard of this amazing app called the Earth app, where our Black and Brown pregnant people and moms are able to actually give reviews on various providers and facilities, because you know, we're not going to take this anymore of the disrespect, and it's time to really hold a lot of these physicians accountable, going after licensure. And I'm just putting it out there. If it takes that to get to that point to where we are starting to see improvement.
Well, I just want to give a round of applause for these amazing women, as you can tell. And we have just a couple of minutes to open it up for questions, if folks have questions. I'd love to hear.
Thank you so much for your share. This has been so enlightening for me. So I'll try to keep it brief. I work for CCHI, which is a membership-based organization that focuses on folks accessing healthcare, specifically Medi-Cal. I run a forum where we have our promotoras, our HAs, our CECs, and we're training them on how to prepare for upcoming transitions we're obviously very busy right now. What are some resources that you think would be helpful for the folks that are boots on the ground to be able to refer folks who are pregnant or may become pregnant so they could access some of these really amazing programs that you're running?
It's so county driven, but what I can say just as a quick answer is that if you find the black and brown doulas in your county, you are going to find the resources, because one of the advantages that we have in California is that we have an incredibly strong doula network, and the doulas know what time it is, and so find the doulas.
Thank you so much. I really appreciate that.
Hello, thank you again for a great presentation. My name is Monica Gomez, and I'm with the California Wellness Foundation. I'm wondering, thank you.
They're one of our funders, y'all. Thank you.
I wonder what advice you have for funders like us, that we recognize the impact of guaranteed income, the benefits, the difference it makes, but I also know that the field of work is evolving, right? Oregon was passing the rebate proposition statewide, universal basic income. How do you see it evolving here, and what recommendations you have in terms of how else can we support the work? And no, not in terms of more pilots, because for us, it's been proven, right? But like, what is beyond the pilots?
All right. Well, so one of the interesting challenges that we have, and this is a good challenge to have, is that California uses its TANF money really effectively, and TANF has been a really fertile ground for some of the other health-focused guaranteed incomes in other states, because so many states leave TANF money on the ground. And so I think that here in California, we need to kind of get creative about what public resources we can use in order to sustain this, and we need philanthropists to be investing in the pilots that are trying to actually make that conversion. I think starting in 2020, people needed cash, and it was really cool to watch guaranteed income flourish in all these different fields, but it also, I think, diluted a little bit the power of guaranteed income, because there was a guaranteed income for every single population, and it wasn't always clear, like, what policy are you trying to shift through this pilot? And so I think that philanthropists need to get really targeted there. I can also say that one of the things that distinguishes Abundant Birth Project from a lot of other guaranteed income programs is that we have been very outspoken about the racial determinants of people's health, and specifically birth. And we've paid the price for that, me personally, but also our program. We got sued very soon after the UNC affirmative action decision came out, and we're still working our way through that lawsuit. I personally have lost jobs over it. It's been like hard. And we need philanthropy right now to step up, because government is like very scared, very, very scared of programs that are race focused. We are for sure gonna lose our NIH grant. I cannot imagine a world where they're like, hey, that radical racial justice program, let's go ahead and refund that research. And that's $2 million that we just lost as we're trying to drive towards producing statistically significant data. And so I think for the programs that are like in the middle of racially radical work that has a potential to change policy, that are really facing the penalties, we need philanthropy to come in and plug the gaps that the Trump administration is creating. But I think also, I was mentioning this, I had a funder meeting today. I was saying, like, I think we might need to go away and be quiet somewhere. Like, I think those of us who are doing some of this work, one of my professors said, you know how you know you're on the cutting edge, Zaya? Because you're bleeding a little. And I was like, word. And so I think that funders need to recognize that the capacity of the activists leading this work is not infinite. We have been through the pandemic, we have been through, like, you know, at least Black activists, we've been through the whole, like, Black Lives Matters and the waning of it, and now we are really in the press of, like, anti-DEI work. And I don't know who has my back. And so we need the funders that are willing to, like, do radical work, because the risk for y'all is very little, relatively speaking. We need y'all to step up and fill the gap.
To add to that, plus to everything like Dr. Malawa mentioned, particularly the racial equity, like, because they need programs that have a racial and gender equity lens, they need more. Like, they need more lawyers, they need more like, they just need more. But also, I would say, like, get in where you fit in. Maybe not having the thing of, like, where, like, what aspect of it, because sometimes all aspects of it, whether it's narrative, storytelling and narrative work, advocacy work, sometimes it's disbursement, sometimes it's admin. but other than like pooling all your money and buying a Supreme Court judge or buying an elected official or something like that, but in any case, but I think like some flexibility in terms of like not necessarily pigeonholing and saying like we should only fund advocacy work now, because I think we've seen that with guaranteed income pilots where we're seeing waves where it's like, oh, we're no longer funding disbursements now. But then some, like rural counties and rural jurisdictions, I think have been left out of the first wave where they were giving disbursement money pilots. But yeah, so I think like having kind of a more multifaceted approach rather than saying like what's the most pressing need, because so many of those things are very contextualized. But yeah.
Oh yeah, and can you guys save our data sets? Can philanthropy like go on the Wayback Machine and rebuild our data sets? I don't know, but it's been really hard to have the federal government pull all of the race and gender data for the kind of work that we're trying to do, because how can you make the data case without the data, which is exactly, I'm sure, what they're thinking. Do we have to stop now?
We have to stop? Okay. Oh, I'm so
But I love questions. I mean, I'm happy to hang out for a second if y'all want to come and find us.
Well, let's just give this amazing panel one more round of applause for their leadership and courage. Thank you so much. Thank you to all of you amazing women. Keep doing what you're doing. And thank you all. And fill out your form or your app.
Oh yeah,
Your app.
get that watch.
Fill out your app. Ping your app.